Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
When it comes to dieting, you might have focused on eating fewer calories as the key to losing weight. But a new study published recently in JAMA, the Journal of the American Medical Association, showed that what you are eating is an important factor in weight loss. The study found that people who cut back on added sugar, refined grains, and highly processed foods, while concentrating on eating plenty of vegetables and whole foods. I thought that was the name of a store, Whole Foods. Anyway, if they did that without worrying about counting calories or limiting portion sizes, they lost significant amounts of weight over the course of a year.
Outstanding.
Something works.
Researchers hope that a focus on quality versus quantity when it comes to calories may be a way to combat the obesity epidemic in America. Here to talk about quantity versus quality when it comes to calories, along with other nutritional advice, is Mayo Clinic Public Health and Preventive Medicine Specialist, Dr. Donald Hensrud.
And author of the Mayo Clinic Diet book,
That's right.
I might add.
Welcome back to the program, Dr. Hensrud.
Thanks very much. Happy to be here with you, too.
All right. Well, you've been preaching diet. Dr. Joyner, who has been with us recently, talked about the importance of exercise. We've been doing this for decades, telling people, yet the latest statistics show that 40% of Americans are obese, and that's a significant increase from a decade ago. How do you explain this?
There are powerful forces in the environment that are controlling our weight. When something changes that quickly, an increase from 34% to 40% in a decade, there are multiple factors that are influencing our weight. We've engineered physical activity out of our lives. We sit at desks. We work on computers, so our activity is less. We're eating a different diet. There's more processed food. And as you mentioned, a recent study showed that as opposed to looking at calories, focusing on real food has benefit. The bottom line with that is sticking to a plan and adherence to it can help anybody. But we have a lot of work to do because of all of these forces that are influencing our weight in this country in a very short period of time.
Would it be fair to say that it's just all habits? It's the way that you shop, buying foods that are more processed versus foods that are raw or fresh. We had said earlier, a remote control that you used to have to get up and go change the channel. So we have a habit of moving less. We have a habit of eating differently. And if we could just change or tweak our habits, that it would make a huge difference.
Habits are a big part of it. I agree. And changing habits can make a difference. Some of these things aren't habits. They're in the environment, in the built environment. We're wired to take the shortcut, to engineer physical activity out of our lives. And you mentioned a remote control. My favorite is not only having a remote control, but asking a child to go get it for you. Or another example is we used to have to walk into the gas station to pay for our gas. Now we just swipe at the pump. When you do that hundreds of times a day, we're burning a lot less calories. And the types of foods we're eating. Nobody has too much time these days, or few people. So we're looking for convenience, for things that taste good. But yet if it's too much processed or is high in energy density, it not only increases our overall calorie intake, but the health effects also of those types of food aren't as healthfully.
So let's talk about the quality versus quantity debate. And is it important to count calories or not?
Calories do count, but paradoxically, we're not good at counting calories. The amount of food we see on our plate does not equal calories. Sometimes we think that volume equals calories. There's the same amount of calories in 1 1/3 sticks of butter, a small amount of food, as there is in 10 or 11 heads of lettuce or 35 cups of green beans. So when you look at that food, it seems more food, but vegetables and fruits have a lot less calories. So yes, calories count, but if we can stick toward whole foods or a plan in the Mayo Clinic diet, we emphasize servings sizes. And the only reason to look at serving sizes of vegetables and fruits is to make sure we get enough. And so if we can stick to a plan that limits our calorie intake indirectly by focusing on real foods, that can be effective.
Now, what do you mean? When you say whole foods, what exactly do you mean?
Good question. That seems obvious, but it really isn't. Unprocessed. So the more we process foods, we add salt, we add sugar, we change the composition and make it a smaller amount of food, but perhaps more calories in it. Whole foods are in their natural state, so fresh or frozen fruits and vegetables. Whole grains contain all parts of the grain, the bran, the wheat germ, and the white part, the endosperm, which has the calories. Refined sugar and flour has the bran and the germ removed, and that's a lot of the fiber and the nutrients. So whole foods in their natural state have an effect on calorie intake and on overall health effects. Those are the healthiest types of foods to eat in general.
I don't know if I'll ever forget one time you said if you shop more on the outside of the grocery store, that's the key. And anytime I go to the grocery store, I actually think of that because all the fresh fruits and vegetables are on the outside. The meat counter, the butchers are usually around on the outside. The dairy is usually around on the outside. And it's all in the middle. It's stuff that is shelf stable and not so good. Maybe delicious.
The chocolate's in the middle.
The Cheetos are in the middle.
All right, now, we talked about you defined whole foods for us. Now define highly refined foods, some examples. And we're supposed to avoid those, right?
Correct. Refining is another way of processing. So you take a whole grain like wheat that contains those three parts, you remove the beneficial parts, and what you're left with is just empty calories, so to speak, without a lot of nutrients in it. That both increases the energy density, the number of calories in the given amount of food, and it decreases the health benefits. So sugar, for example, has increased dramatically in this country over time, and that's probably partially related to the increase in weight. Refined sugar, which is taking carbohydrate and putting it into its simplest form. It's easy to digest, you get a lot of calories, and weight can creep up and we don't even realize it.
One of the things, going back to the grocery store around on the outside, the dairy foods seem to have gotten a bad rap over the last few years. So you've got the fresh meats and the fresh fruits and vegetables. What about dairy? What about milk and cheese and yogurt?
Yeah, if you look at dairy in general, it's probably not the perfect food that some organizations would like us to believe. It is a source of calcium. And even within the dairy foods, there are probably differences. Yogurt and kefir with bacterial cultures, i.e. probiotics, are probably the healthiest. Cheese is probably a push. The lactose in cheese is refined. And whole milk with saturated fat is probably the least healthy. You know, there's been some talk in recent years about saturated fat, that we don't have to watch it as closely. If you really look at the data closely, we still need to watch our saturated fat intake.
All right. You've been studying people's diets for a long time. What have you learned about the difference between someone who can get weight off and keep it off versus someone who can't?
There are things that have been shown in the literature that are related to long-term success. One is, paradoxically, don't try and go on a diet. Diets imply something that's negative, restrictive, and usually time-limited, and therefore people aren't going to stay on it long-term and keep the weight off. Instead, look at changes in the way you eat, just lifestyle habits. That's what we promote in the Mayo Clinic Healthy Living Program, where we show people what to do in our kitchen. Another thing is social support seems to be important for people. It's hard to do it alone. Another is to have a realistic, practical, and enjoyable plan. That's part of that lifestyle change. If you're feeling like you're going uphill all the time, people can't live like that. And so they revert back to previous habits. So there are some things that people can do to set them up for success. And paradoxically, going on a very rigid diet is not one of them.
So tell us about the second edition of the Mayo Clinic Diet book is now out. Congratulations.
Thank you.
New York Times bestseller. So what's new in the latest edition?
People said they wanted more recipes. We provided that for them. In the new book, they wanted more meal plans, some ideas about that. So we have 4 weeks of meal plans in the new book. We also have a couple tables that I particularly like. One is a mix and match table for entrees, where you pick a protein, you pick a grain, you pick another ingredient, a vegetable, and you put it together. So it's kind of like pick one from column A, one from column B, and you can tailor the food, your entree, to your own liking. Same thing with salads. You pick a green, you pick a dressing, you pick some additives, some toppings, and people can customize their own food to their plan.
So it sounds like there's a little bit of work involved in following the Mayo Clinic diet, but in general, the feedback has been good. I mean, have a lot of people been successfully using this diet? I shouldn't call it a diet, this plan.
Well, what's interesting is we chose that term because that's how people look for weight management, is a diet. But it's more than a diet, it's a lifestyle plan. And we have received a lot of feedback. What's interesting about any dietary plan is that if people stick to it, they'll lose weight. Some are easier to stick to than others. We promote real food in our plan. And we think that people can adopt it. It's possible to eat well and eat healthy. I might mention we try to have something for everybody. We have the Mayo Clinic Diet book. We have the Mayo Clinic Diet online program people can do. We just came out with a great course for adult learners on the Mayo Clinic Diet. And on site here, we have the Mayo Clinic Healthy Living Program, where we have a 2-day on-site program with a year of coaching to help people because we know how challenging it is.
Yeah, and that's been pretty successful.
It has.
All right, we're talking with public health and preventive medicine specialist and author of the Mayo Clinic Diet book, Dr. Donald Hensrud. We're talking about diets and counting calories. Time for a short break.
When we come back, we'll switch gears and discuss some myths about weight loss. We're also going to talk about food diaries. Is there such a thing?
Well, I'm sure there is. We'll find out if it works. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We are with Dr. Donald Hensrud. He's an expert in public health and preventive medicine and also the author of the Mayo Clinic Diet book. So, Dr. Hensrud, you have a question before we get to the myths, or matter of fact, the diary.
Food diaries. I mean, between keeping a diary of how much I'm spending and how much I'm eating, I lose out both ways. How helpful is a food diary?
It can be very helpful for some people. First of all, there's a food record where you just write down what you eat. A food diary, you may include other things, where you were, who you were with, how you were feeling, and it can help people identify situations where they might overeat.
How you are feeling is interesting.
It is. And weight loss is very interesting, weight management. The psychological effect of that is tremendous. And people who've tried to lose weight, I've worked with them for years and years, there's a vicious cycle that develops. People feel guilty. They beat themselves up. Then they eat more, and then they feel more guilty. It can really impact somebody's psyche. We try and take the heavy lifting off of them and get them to enjoy food and how they're feeling when they're with somebody they enjoy. And paradoxically, that can help eat better and manage weight.
I love Cheetos. You love ice cream. There is an emotion involved
and chocolate.
with this.
Don't forget. Ice cream and chocolate. They're both good for you, I think.
All right, let's talk myths.
All right. Myth or matter of fact, red meat is killing us.
Well, if you look at the objective data, yes. Red and especially processed meat is associated with an increased risk of colorectal cancer, type 2 diabetes, interestingly enough, heart disease, and overall mortality. Now, we're not trying to turn everyone into vegetarians, although if people want to, that's fine. But people should be conscious about what they're eating. And here's where I use quality and quantity. Instead of going for quantity with things such as meat, chocolate, cheese, and wine or alcohol, go for quality. Instead of having a double cheeseburger with bacon and everything, have a nice filet and really enjoy it and stay on the program. So you can have your cake and eat it too with a little bit of adjustments.
I'm doing what he said. When it goes to ice cream, I buy the high quality. I don't buy the cheap stuff.
It's right. Okay, how about this? Myth or matter of fact, obesity is all about willpower, not biology.
Obesity is very complex. It starts with genetics. It's been estimated that 30 to 40% of our weight is set by genetics. In reality, it's a complex interplay between a genetic predisposition and a permissive environment. Willpower is probably overrated. If you think about it, all of us have some willpower. We've done things where we've really had to get our willpower. But when you're in an environment that is not conducive to managing weight, it can deplete our willpower over time. So the trick is to set yourself up in a situation that it's easy to succeed. It's easy to take that walk. It's easy to make the good choice. And that's much better than just relying on willpower. Just saying no doesn't work with food.
All right, how about this one? A low carbohydrate diet is more effective for weight loss than a low fat diet.
The most recent recommendations from the Obesity Society, the American Heart Association, and the American College of Cardiology say there is no one best diet. The best diet is the one that people stick to. The beauty of this, it gives people some choice. Some people may prefer a lower carb diet. Other people are lower fat diet. And there are many different options. What we try and say is stick with a diet that has healthy fats and healthy carbs. The proportion matters less than trying to eat real food and eat healthy, and then the weight can often take care of itself.
What about myth or matter of fact, I can eat as much avocado as I'd like? I'm sorry.
You sure can, because you don't need to share it with
I'm
me.
sorry. I was just that I just popped right out. But
With
boy,
the-
do I love avocado.
And I'd say enjoy it. With any food, however, calories count. So
All
there
right.
is a limit even on avocados.
Okay, myth or matter of fact, eating breakfast is necessary to lose weight.
The literature is a little mixed on this. It's not entirely clear, but the majority of the data show that eating breakfast is helpful for managing weight. People try and restrict themselves and eat less, and I've seen some people who eat one meal a day. That can actually lower metabolic rate and make it more difficult to lose weight. In general, when people skip breakfast, they may make up for it by eating more later in the day.
All right, here's a big one. Supplements can help you lose weight.
No.
That was easy. Next.
Well, why do people look for that then? Is it they think that it's a trick?
It's a losing weight is a very difficult problem. We want to believe in the supplement. We want to believe in an easy solution. It does take some time and planning, but it doesn't have to be drudgery. But supplements in general are not the answer. There's no silver bullet.
Myth or matter of fact, diet soda helps to cut calories. If you're trying to lose weight and you can't give up pop, should you switch to diet soda?
Well, it's a mixed, like many things. The truth lies somewhere in between. Diet soda doesn't contain calories. A regular soda has about 150 calories, so you are saving that amount of calories. But studies show that people who consume diet soda tend to weigh a little bit more than people who don't. And the theory is, it hasn't been proven, that our brain is tricked a little bit. When we're drinking diet soda, we may crave other sweet foods, and that's where the calories come from.
Because your brain thinks it's getting sugar, but it ultimately does not.
It tries to get it from other
So
sources.
it goes, yeah.
All right, no sugar in that can of pop. I've got to go
Okay.
to the candy bar. Right? All right, this one. It's tough to keep weight off because losing weight slows metabolism.
Again, the truth is somewhere in between there. When we lose weight, we lose a little bit of muscle mass, and so our metabolic rate slows down a little bit. However, if people can keep up their physical activity, they can more than make up for that by burning more calories through regular physical activity.
All right.
You can lose weight with exercise alone.
Yes, but it takes a huge effort. We can't usually get an energy deficit enough to lose a significant amount of weight. In other words, the calories we eat versus the calories we burn, we can't burn enough calories to lose weight. Studies have shown weight loss is more dependent on diet than physical activity, although physical activity can help keep the weight off.
It seems though that when I'm exercising that I crave healthier foods, or I don't crave unhealthy foods as much when I'm exercising. Am I imagining that?
Probably not. Many people, I talked about a vicious cycle that people get into earlier. You can be in a positive cycle where if you change one healthy habit, it's been shown in studies that other healthy habits can change along with that because you're on a roll.
All right. A calorie is a calorie.
Once again, somewhere in between. Calories do count, but there are things that modulate that. For example, we know that people who sleep less than 6 hours or so tend to weigh a little bit more. So they're eating the same calories, but something changes in the body. Calories do count, but there are things that modulate that equation.
All right, Dr. Donald Hensrud, thanks for updating us on diets and counting calories. Dr. Hensrud is a public health and preventive medicine specialist and author of the Mayo Clinic Diet Book. Dr. Hensrud, thanks so much for being with us.
Thank you very much for having me.